Good afternoon, everyone. My name is Lori Bombacco. I'm an oncology dietitian, and I'm presenting to you live from Cancer Wellness Center. I'm in a different part of the building today because it's such a gorgeous day that I had to show you the background. I mean, isn't this a lovely place? Wouldn't you want to come here and do some sort of physical activity that we have many classes inside this room. Check out the website, check out the calendar to see what's available. Even if you attend virtually, it's an opportunity for you to move your body, which is a good thing. So today I'm here to present one of my favorite programs. It's called Ask the Dietitian. We happen to choose a very popular topic today. So we had many questions that were submitted. There is a chance that I will need to break this presentation into two parts because of the amount of questions that were submitted. So stay tuned. We'll see how many we can get through today. And then we may have a second segment for Ask the Dietitian. So what I'm going to do is I'm going to share my screen like I always do. Those of you who registered, you'll get a copy of the PowerPoint presentation, as well as some additional resources and recipes. And for those of you watching live on Facebook, thank you for joining us. It's good to see you all. So I'm going to share my screen and present my presentation for Ask the Dietitian. Thank you again for joining us. So good to see everybody. So our topic, as I mentioned, it was a popular one, and I'm not surprised. It's all about digestive health and which foods might we need to choose or want to choose for some of our digestive concerns. You know, I am an oncology dietitian, so that's what I specialize in. But many of the participants I work with here or where I am in clinic, many of the patients I work with have some digestive concerns, whether it be a baseline concern before they're even diagnosed with a cancer or as a consequence of their cancer treatments. So we see a lot of overlap here, and hopefully the information I shared today will be helpful for you. So on the agenda, I'm going to go over those questions that were submitted with my best answers possible. I'll offer some additional resources and recipes along the way. So first, I just want to talk about the digestive system, just a couple slides, because I think it's really compelling information, what we know and what we don't know about the digestive system. So the GI tract, just so that you know, so what is the digestive system composed of? It's first and foremost the GI tract. So it's hollow organs that are connected by this long twisting tube. So we go from all the way from the mouth all the way down to the anus. This twisting tube is long. It's 30 feet in length. Think about how long that is. So it's a very busy digestive system we have working for us. It also includes those hollow organs, the liver, the pancreas, as well as the gallbladder. And then did you know that there also are some bacteria and microorganisms that live all along this long twisting tube? And our nervous and our circulatory systems also help in the parts of the digestive system. So again, it's a really busy place, right? Lots going on here, thank goodness, because we need digestion. And this is why I do what I do. We need to obtain nutrients from the food and drinks that we consume in order for our bodies to work properly. Each part of our digestive system helps to move food through the GI tract and break it into smaller parts so that we can absorb those nutrients. So there's a lot that happens in order to make that possible. It's chewing, squeezing, mixing, there's stomach acid, there's bile and enzymes, and that all helps to make this possible. Now, the small intestines, really, that's the site of absorption for nutrients. And our circulatory system is highly involved at that step of the GI tract in order to help take those nutrients out of the small intestines and pass it along to the rest of our body. So let's move on to the questions that were submitted. They were great, so thank you so much for everyone who submitted them. The first is how to balance fiber, fluids, and FODMAPs to minimize recurrent IBS symptoms, retain nutrients, and to gain weight. What foods aid best for IBS? How can diet help with IBS, but especially the constipation type of IBS? So those questions, those first three, are going to be lumped together with my answers, you'll see. The fourth question, what food is the best for people that are struggling with GERD? How to promote a diverse microbiome? how intestinal microbiome starts in the mouth, how much fluid is optimal to drink in order to stay hydrated during the hot weather, and do we need to increase it during the summer versus in the winter? What are some of the best remedies for digestive issues? Can certain foods help improve digestive health? Is steak okay to eat if you are on chemo? Also, I've heard a lot about fasting before chemo. My thoughts, please, on that, and I do have some to share. I need more suggestions on eating 6 small meals versus 3 large meals, and then how to get adequate nutrients post-treatment, a real issue for those with bowel cancer. So lots of great questions submitted here. Thank you all so much. Let's try to chip away at as many as possible today. So the first 3 questions that you noticed were related to IBS or irritable bowel syndrome. So how do we balance fiber, fluids, and FODMAPs in order to really control and manage the IBS? And is there any foods that can help do that, but especially for constipation? So let's start first with IBS, irritable bowel syndrome. Perhaps you've heard of it, right? Chances are you have, because there were 3 questions all about IBS. So with IBS, diet is helpful to in part of an integrative plan, right? So diet's not going to fix IBS. You absolutely need a medical intervention, but diet can complement that medical intervention in order to help control symptoms. I think most importantly, improve quality of life, but also to optimize digestive health. It's important to point out that a food may trigger symptoms in one person, but not in another. So this diet approach to IBS needs to truly be personalized, right? So I'm going to go over some general strategies, but ideally the best approach is one that's individualized, and a dietitian can help with that. That's what I would encourage. And certainly there are dietitians who are experienced in the digestive issues, just like I'm experienced in oncology nutrition. We do have some dietitians that work within gastroenterology clinics and within their practice. So I would encourage any participants who are interested to explore that. So what are the general tips for IBS? So I think what I understand about the gut and our digestive system is that it likes routine. So we can sort of train it or condition it. So if we can be consistent and develop a rhythm or a routine to our eating, we can also sort of train and condition our gut to understand that routine and rhythm. So consistency, I think, helps. And what I'm referring to is consistency in terms of what you consume, how much you consume, and when you consume it. So if you can keep a nice rhythm to that day in and day out, it really does sort of help the gut get acclimated to what is coming, right? I also would encourage almost anybody, regardless of whether or not you're dealing with IBS, to chew your food well. Right? I'm guilty of not doing that sometimes. So we know that digestion can be off if we're really eating through our meals rather quickly. A short-term trial of a low FODMAP diet may help identify specific triggers. So short-term means only 2 to 6 weeks maximum. And I would encourage anyone that's contemplating a low FODMAP diet to only do this under the guidance of a clinician. So dietitians like myself can help do that. It is an elimination diet, and the point of this diet is to find what is the specific food trigger for that person. So it's very strategic in terms of when it introduces a certain carbohydrate, as it turns out, to test if the gut is a trigger for the gut. Right. So it's done in, again, a very strategic way. And in very small amounts, a specific food is introduced. So what that does is it helps discover for that person what the trigger is, but I think more importantly, what are not triggers, right? So that we don't have to be on such a restrictive diet. That's the last thing I would want anyone to have to do. Regular activity has been shown to be beneficial for IBS. And you might know this, I think it's very fascinating, but there is a strong connection between our brain and our gut. So as it turns out, we do see if someone has an episode of increased stress or increased level of anxiety, they may have an episode or an attack, I would say, of IBS. So if you have connected the two, chances are that you would benefit as well. Maybe everybody would benefit from stress and anxiety management, but certainly calming strategies, and this is being explored more and more for individuals with IBS. So walking in nature or Tai Chi, writing, professional counseling is often found to be clinically effective in helping to manage IBS symptoms. So if you haven't been introduced to this concept, I would also discuss this with a clinician to see if there are things that you can explore for yourself. This is why there are some medications that are often used in IBS. Patients I've worked with, some anti-anxiety medications are used because just like they ease the mind, they also ease the gut. I think that's so fascinating. So this low FODMAP diet, what is that all about? So it's all about these fermentable carbohydrates. So the F in the FODMAP stands for fermentable. The O is oligosaccharides, and those include the FOS or fructans as well as GOS. And you see the examples of oligosaccharides. And then there's disaccharides, including lactose, monosaccharides, including glucose and fructose, and you see the foods that that are naturally high in these particular carbohydrates. And then lastly, the polyols, and that includes sorbitol and mannitol. So there's naturally occurring sources of the polyols, but also too, we find them added to foods. So very commonly in sugar-free choices, especially mints and gums. So these are potential triggers for an individual. And as I mentioned, in this low FODMAP elimination diet, one would very specifically choose a food from any one of these groups, one at a time, while the rest are eliminated, and then test that particular food and learn how much of that food someone can eat before it triggers a symptom, right? So for example, somebody might be able to tolerate lactose in a half a cup serving, but not in a cup serving. So that's part of the low FODMAP diet, is identifying which are the triggers and how much of that trigger can one consume before it causes the trigger. Hopefully I'm explaining that okay. So a simplified approach to do this, if you're not thinking you want to do an elimination diet, is I would suggest that fruit seems to be problematic for some people that have that as a trigger. So I would have one serving of fruit at a time. I mention that because I'm guilty of having like 2 or 3 servings at a time. I just love fruit, especially this time of year. And so having no more than 1 serving at a time, and then also spacing that out. Okay, so having maybe another serving another 3 hours later. Okay, so the gut is having only a small amount at a time. Choosing cooked vegetables more often than raw. They seem to be better handled. And there's some specific choices I'm going to talk about in a moment. Like the gas-producing vegetables as well as legumes. So that includes the beans and lentils. We do find that these are triggers for many people. So broccoli, cauliflower, cabbage, Brussels sprouts, chickpeas, lentils, and black beans. If you notice they trigger this gas for you, then yes, they're probably a triggering food. So we might need to learn how to cook them or how to consume them in smaller quantities if you still wish to include them in your diet. And then limiting sugar, alcohols, and artificial sweeteners. So those polyols, the sorbitol, mannitol, xylitol, maltolol, and erythritol. So the OL suffix is a big one to look for if you're concerned that sugar alcohols might be triggering this problem for you. This seems to occur for those who have IBS with diarrhea. So if that is you and that's the case for you, this might be a good place to start, is to look for those polyols. And I listed on the slide before where they naturally occur in some of our fruit and vegetables, but where they're also added to some foods. Okay, so you see also listed here on the slide that prunes, cauliflower, mushrooms, they are high in naturally occurring polyols, but then those sugar-free gums and candies, they are loaded with these sugar alcohols. So they seem to trigger diarrhea for some. Additional considerations is, and this is one of the questions, what if you're constipated with IBS? Well, we would want to add some fiber, but not just any fiber, specific fiber that would be tolerated, right, on a low FODMAP diet. So things like flax seeds, oats, there is such a thing as inulin and psyllium that are supplemental and could be found in functional foods. And that's, again, where a dietitian can help and include those in more increasing amounts in order to help with IBS, with constipation, while still being on a low FODMAP diet. We would avoid wheat bran and prunes. Those are fermentable fibers, and they can trigger symptoms of gas and abdominal pain if you're constipated, right? So you might be constipated and think, oh, I need to eat some bran, I need to eat some prunes. They may be just exacerbating the problem. And then it is important, if you did not know this already, to rule out a gluten intolerance and celiac disease if you're looking to figure out, do I have IBS or not, right? And hopefully that was done if you were diagnosed with IBS, that was already ruled out. It is possible for people to experience an intolerance to the carbohydrate in wheat instead of the protein in wheat. So if you have a gluten intolerance or celiac disease, the strategy then is to minimize consumption or avoid wheat. But that's not the problem for someone with FODMAP. They may need to just have a different version of wheat, like 100% sourdough bread. And that usually seems to be well tolerated for that person who is finding that wheat is their FODMAP trigger, right? It's very complicated. So here's the bottom line on IBS. To get back to those questions, I don't want someone to be on FODMAP long-term. That is not the solution, right? It's at max a 6-week diet trial to identify what food might be the trigger and how much is the trigger. Consume mostly water for fluids. We know that this is best for our gut and what our gut can handle. And I'm going to talk a little bit about hydration in this presentation in a moment. We're going to troubleshoot potential triggers for diarrhea using that list that I shared. So it seems like diarrhea may often come with some of those polyols, as I pointed out. So that might be a good place to start if you're looking to identify what should I probably stay away from or minimize, especially with diarrhea. And then aim to gain weight. And I do this often in clinic where I also work. We just simply add 250 calories. So do what you're doing, but then add on 250 calories. So I have lots of suggestions and examples to do this, and that will be included for those of you who registered. I have a handout for that. And then what foods are best, go back to this questions, right? What food is best for IBS and especially constipation? So try adding those higher fiber, low FODMAP choices like oats or flax seeds, and that will help with gradually help promote our bowel movement, okay? And physical activity for sure, okay? Let's move on to the next question. What food is best for people that are struggling with GERD or gastroesophageal reflux disease? So I have to first, of course, start out by saying that the proper treatment of GERD always begins with a visit to the healthcare professional of your choice to obtain an accurate diagnosis. We want to know what we're dealing with, right? Because we don't want GERD to go untreated. Treatment may include medications that might be prescribed by the physician and certain diet and lifestyle changes. That's where the dietitian comes in. So a combination of approaches and some trial and error may be necessary in terms of this approach to managing GERD, especially with diet. So we do see that a good place to start is to avoid certain triggers. It's sort of similar to IBS with FODMAP. It makes sense to try to avoid the things that you identify as a trigger for you. So this list is a general list. It may not always pertain to you. Okay, so keep that in mind as I review that list in a moment. But it doesn't, so we don't want to cut out all of our favorite foods, but just make some simple modifications. That seems to work very often, very effectively for patients I work with. So what to avoid? I think it's, again, important to point out that it's really about discovering what works for you. Okay, so really paying attention to the body, and some people use a food journal to do that. But it's important to point out that not all triggers and treatments will affect everybody in the same way, right? And also bear in mind that when you eat is just as important as what you eat. So you might find if you eat something earlier in the day versus later in the day, you have a different reaction in terms of the GERD. So really important tips to point out. Now, what about those triggers? Here is the list. So we find that these are the most common triggers for GERD: the high-fat foods, caffeine, chocolate, onions, peppermint, alcohol, carbonated beverages, and then citrus and tomato products. So not all of these are trigger GERD in everybody, right? Only maybe one of them or more than one of them. So it's important to identify for you what seems to be the trigger and what to minimize or avoid altogether. The way that these trigger GERD is what they do is they lower the lower esophageal sphincter pressure. So anytime any of these foods are consumed, the sphincter does not close, but it stays open. And so contents in the stomach will travel back up, up the esophagus, and that causes the symptoms of GERD. So what are the best choices to eat? I always like to recommend, what can you do, right, if you're struggling with something? So we'll start out with fruits. We know that even especially non-citrus fruits, because that was on the trigger list, they're great for nutrition and for helping to manage some of the symptoms of GERD. So things like bananas and melons, which are in season, and apples and pears are great. A wide variety of vegetables should be well tolerated for GERD. Our high fiber complex carbohydrates like oats, whole grain bread, brown rice, even couscous, these are really great sources of complex carbohydrates, super nutritious for us, and should not exacerbate GERD. Same goes with some of our other starches like potatoes and root vegetables. These are healthy carbohydrates, and they also are a great source of digestible fiber that keeps things moving, right? Keeps our digestive system going in the right direction. Additionally, we want to minimize high-fat meats and choose instead lean meat. So high-fat foods, and that meat is in that category, as well as fried foods, they lower that LES pressure. And so they delay stomach emptying and increasing the risk for reflux. So choosing lean meats, and then also choosing preparation methods that do not introduce a lot of fat to the cooking, right? Like grilling, great time of year to grill, but also poached, broiled, and baked choices. And then fat is a trigger. So high fat foods and meals that are high in fat can trigger GERD. So we want to minimize fat in general, but of the fat we're eating, we want to choose our quality choices that are also very nutritious. So this includes monounsaturated fats, and you see the examples listed on the slide, as well as our polyunsaturated fats. And examples are listed there. They're very nutritious and important to include in an overall healthy diet, and in smaller quantities in order to manage GERD. So the bottom line on GERD is try to limit and avoid triggers, experiment with what and how much will work for you. It's always important to keep good posture during and after a meal because gravity can be an enemy, right? So we want to sit up straight while we're eating, avoid lying flat for at least 2 hours after we eat. And then standing up and walking around really does encourage digestion. I find that's helpful for constipation as well. And then this is a big one, avoid eating immediately before bed. This is sort of like a recipe for disaster. So when we eat a big meal and then when we lay down, what happens is there's a lot of food in the stomach to make a lot of acid, and then we're reclined. So gravity is going to work against us. So timing can vary from one to another, but generally speaking, if you have a full meal, try to wait to go to sleep 3 to 4 hours. If you suspect that food may trigger or worsen your symptoms, you may want to try even a week, just keep a daily diary and see if you can identify what the problem is for you. And this may be our last question. We're going to say yes. I think it's going to be our last question for today. So how to promote a diverse microbiome and how intestinal microbiomes start in the mouth. Well, I think the second part of this question is an interesting one. I wish I had more to share about this, but we are really only on the cusp of understanding about the microbiome in the mouth. We know a lot more about the lower GI tract, so what's in our small and large intestine, but in the mouth, we're only just learning. So stay tuned because hopefully we'll learn a lot more what microorganisms are in our mouth, how that affects or influences health and disease. We'll find out hopefully soon enough. So a little bit more about the microbiome. It used to be called the forgotten organ because it's this pretty massive, influential thing that we have called the microbiome. So our microbiota is defined as the collection of the microbes that live actually on our skin, but also inside our body. So it includes viruses, bacteria, and other microorganisms. The largest amount of the microbiota exists in our large intestine, as far as we understand. Now, the microbiome refers to all of the genes that make up all of the microbiota. Now, this is massive. So it's more extensive than we might realize. The number of genes within the microbiome is much greater than the number of genes in the cells of our body. So imagine how the microbiome influences us, because there's an interaction there between our genes and our cells and the microbiome. There's a strong connection that we do know between the microbiome and our immune system. So the microbiome sort of trains the immune system how to respond to things. And on the other side of the spectrum, the immune system also keeps the microbiome in balance. So there's this nice interplay between the two that we're learning more and more about. Now, the ideal microbiome, we don't really know how to describe that. We don't really know which microbial species are beneficial for us, or a specific disease or condition, or how to repair if that microbiome has been damaged. What do we do for that, right? We still don't really quite know, right? There's some strategies to work on, but there's really no definitive guidance at this point. What I do understand is that experts think that a diversity of species is what is desired for a proper functioning gut. So that means lots of different microbiota that are coexisting. And what we do know from research is that we can support microbial diversity by, you guessed it, a plant-based diet. What do you know? So cancer protective and supports the microbiome. So this plant-based diet isn't necessarily vegan or vegetarian, but it's consuming a lot of whole plant foods from a variety of fruit, vegetables, beans, lentils, and whole grains. So high fiber, nutrient rich choices that I advocate in terms of supporting the microbiome are listed there: apples, artichokes, blueberries, almonds, and pistachios. They sort of rank highly on this list, including some fermented food because they contain live microorganisms. So fresh sauerkraut, fresh kimchi, yogurt, and then fermented alternatives to dairy, and then kefir, and as well as kombucha. And then including prebiotics, if you haven't heard of that word, prebiotics means that it's essentially fuel for the microbiota because it needs to eat too. So what do you know? When we consume prebiotics like garlic, onion, bananas, and even artichokes, we're getting nutrition from it, but there are special little fibers inside those foods that we don't use, and they go directly to the beneficial microorganisms that are living in our gut. And when we feed them well, they get to behave well. And it benefits us. So have you heard of this concept called the diversity diet? If you haven't, let me introduce you to it. So it's an early research has shown that 30 different plants in a week, 30 different plant foods in a week, which I bet you can do, makes up this diversity diet. So it's sort of like move over 5 a day, because that's what we always used to advocate. A really great campaign, 5 a day, 5 servings of fruits and vegetables every day. Love that. But there's a new goal. and some experts are thinking that if we eat up to 30 different plant foods a week, this may support microbial diversity in the gut. And that really stems from researchers out of the American Gut Project, a great website if you want to just kind of have fun and play online and look at their website. They found in their research that people who ate more than 30 different plant foods each week had a more diverse gut microbiome compared to those who ate 10 or fewer. So this sort of speaks to diversity in food choices, right? So not eating the same things day in and day out, which is sort of what we become accustomed to. But think about how many different choices you have in the realm of plant foods, right? If you're having beans, you can have black beans, you can have cranberry beans, or you can have navy beans. So right there, there's 3, right? And our herbs and spices are plants too. So that's a whole untapped area to consider as it relates to increasing diversity in your diet. What we also found, which was really interesting, I didn't find it, but our lovely researchers at the American Gut Project, they found that those people that were eating at least 30 a week, 30 different choices, they produced more in their bacteria in the gut they produce more short chain fatty acids. These are a good thing. So as it turns out, having more short chain fatty acids seem to be associated with a reduced risk for colorectal cancer. Really fascinating how there's an interplay there. Okay, so because of the time, we have about a minute remaining. I think I'm going to end there. So we're going to pick up on segment 2 with some of the better remedies for digestive issues that I've come across and that I've done my homework about. And I'm going to stop my share here and